PRP, as mentioned, is an injectable therapy. It can be either combined with a hair transplant to accelerate healing and recovery, or it can also be used as a standalone product, usually in combination with another injectable therapy called mesotherapy, in order to boost hair growth. So what will happen now is our patient Mark is going to come through. He already has some local anesthetic on his forehead, which has had some time to work. In addition to that, Dr. Lolan will inject additional local anesthetic into his head for the therapy. He won't feel those injections because of the cream that is already on his head. I will then proceed to take some blood from the patient's arm, which we will place in the centrifuge, and that will spin in the centrifuge for a couple of minutes until the layers of blood have separated. Once that has been done, I will take out the PRP, the platelet-rich plasma, from the test tubes, and that will then be injected into the areas in question, namely all the areas where surgery has been done in Mark's head, to improve healing and accelerate recovery. This is after Mark's blood has been centrifuged for 20 minutes. His red blood cells have collected at the bottom of the test tube. Above that is the gel layer. Above that, this clear layer is the PRP, the platelet-rich plasma. That's the layer that we're interested in, and above that is a layer called the PPP, which is the platelet-poor plasma. But this is the layer in question that we'll be using and injecting into Mark's scalp. I'm going to hold the tube up now to the light so that I can clearly identify the PRP layer. We have now collected a total of 5 ml of PRP, which will be placed into Mark's scalp.